Welcome to the Brain People Podcast, a show where four mental health experts team up to bring you practical tools for overcoming mental health challenges. The Brain People don't replace your doctor or therapist, but we will give you some extra tools to help you on your journey. So join us as we fight mental illness, one episode at a time. Welcome to the Brain People Podcast. I'm your host, Dr. Daniel Binus, and I'm a psychiatrist. And today I'm joined by my co-host.
My name is Jonathan Edens. I'm a psychiatric PA.
Today's topic is something that you might not have expected from a mental health podcast, but we're going to be talking about hydration and mental health. And before you think, oh, that sounds a little boring or kind of odd, hang tight. We're going to make it super exciting. So you're going to be amazed by the end of this podcast how much there is to learn about staying hydrated and the benefits thereof. So first question, Jonathan, why are we talking about hydration? Like, why is that even important?
Well, it's incredibly important for a number of reasons, and obviously we're all familiar with water. People do have some differing opinions, surprisingly, when it comes to how to optimally stay hydrated, what its role and function is for the human body. But we've all probably heard that the human body the majority of it consists of water, and so certain estimates by mass are that a human body consists of about 60% water. Certain organs like the brain, for example, is actually higher concentration, so 70 to 80% water.
Wow.
So throwing off your hydration balance, it's very, I think, easily understood that could throw off a lot of different things and how the body and the brain function, right?
Yeah, it's amazing. I mean, I notice sometimes if I'm tired or this or that, and then I'm like, oh, I haven't drank water in a while, and I tank back up, it does make a big difference. So case in point. So let's talk a little bit about some of the negative effects of dehydration to us physically, mentally, et cetera.
So our bodies can only survive for a few days without water, right? 3 to 5 days, and you will die if you don't drink, right? And so, as you can probably imagine, both in kind of an acute setting of not drinking any water for a short period of time, or in a prolonged setting of drinking less than what would be considered optimal for you, that could also have some significant negative consequences. But severe dehydration, signs, I should say, of severe dehydration can occur within the first 24 hours of not drinking any water. And, this can be a myriad of different problems, but some of the more profound ones that often people end up being hospitalized for are going to be things like usually neurological or cognitive issues, things like confusion, right? You probably had patients that have shown up and you've had to send them for an evaluation of their hydration status as a result of the way that they're presenting cognitively, right?
Yeah, there's definitely people that I can think of, patients that I treated that it was like pulling teeth to get them to drink water. And one particular lady that I'm thinking about, it was just like even getting her to drink, anything more than like 10 ounces a day was very challenging. And you could see the level of, or lack of clarity, I should say, and just the confusion that she would often enter into. And, were there other issues playing a role? Probably. But I think dehydration was a big factor there.
And so chronic dehydration, I think, is understandably, like, it can affect pretty much all of your vital organs, right? Your cardiovascular function is going to be impaired. Your kidney function, your liver function, your brain function, your skin turgor, sometimes as we use, right? Just the quality of your skin, even more. I should say non sort of physical feelings like mental health, which we'll get into in a little bit more detail here, and this will be more the primary focus today on the effects of hydration. But so there's a myriad of different problems that can result from both acute and chronic dehydration.
And one question I would have there too is, what are some of the potential signs or symptoms? Because obviously when it gets into a more extreme state, like you said, the confusion element, I'm sure well, yeah, eventually you die from not drinking water, et cetera.
Yeah.
But what about earlier on? What are some of the signs that we might look for?
Well, it's non-specific, as you can probably imagine. If we're going to talk, I should say, of some of the signs that are going to be more specific, things like thirst, dark urine, right? Those are the fairly obvious ones. But the more non-specific signs or symptoms would be things like fatigue, brain fog, trouble with sleep, maybe even some change in emotional patterns, maybe just changes in how your skin texture feels. Depending on if you have any certain health comorbidities, those could be exacerbated as well. So it's a wide variety of different things, and it's going to be kind of specific to the person.
Yeah. And what about headaches? I mean, I think that's something
that would be a big one. Yeah.
A lot of people struggle with different types of headaches, and obviously not all headaches are related to dehydration, but it seems like a good chunk. I'm not sure exactly what the estimates are, but it's a pretty high percentage, I believe.
Yeah, it's definitely a common cause. So there are, there's a number of different ways in which human beings do dehydrate themselves. And so I think it's important to kind of have an understanding of what the requirements for the body is when it comes to water intake, and then how we tend to lose that water throughout the day. So the obvious one is peeing, right? So urine loss, that's where you're going to get the majority of the loss of fluid throughout the day. But also things like just mild sweating. Like most of the time, even at room temperature, or I should say, even in a moderate temperature room, there's still going to be, beads of sweat that are forming that just aren't really visible to us that we are losing throughout the day. And of course, moderate to severe sweating, there's significant loss there. But breathing, actually, you do lose quite a bit of water vapor every time you take an exhale. And then feces are also another one. So in total, collectively, at a baseline, we're all losing about 2 liters of water per day. All right.
Yeah.
So, there are definitely some factors that are going to take that to another level. We mentioned exercise, but things like caffeine, alcohol, these are well-known diuretics, and so you're going to urinate more as a result of drinking those things.
And one thing I'll say there is, sometimes, like we said, we gauge like our hydration status by the clarity of our urine. When you're drinking, if I should say, you're drinking caffeine or alcohol, urine can be very clear, but that does not mean that you're well hydrated, because you're actually peeing out excess fluid and getting more dehydrated in the process.
Yeah, and a lot of the electrolytes, which we'll touch on as well, which is generally considered to be one of the main problems with the hangover effect, right? You're losing a lot of fluid, but you're also losing a ton of electrolytes if you're drinking alcohol and not replenishing those stores. So some other things that would lead to additional fluid loss above that 2 liters per day are things like hotter climates. We can understand that living here in Sacramento. Certain illnesses or medications. A lot of the psychiatric medications that we prescribe do tend to be dehydrating agents, right? They leave patients feeling quite dry. And so there's a compensatory mechanism in which individuals need to consume more water as a result. So with that being said, like we can lose maybe up to 4, 5, 6 liters a day, depending on all of these factors. And I know very few people that are actually drinking that much, in order to compensate for that.
And one of the caveats there, of course, is we don't get all of our fluid from water, right?
And we'll talk about that.
Fluid, but food obviously as well. But one thing, speaking of food, that has occurred to me, and there is some research to support this as well, is a lot of times when we're chronically dehydrated and we just get used to that, and we're not paying attention to that kind of thirst urge, if you will, and we're not satisfying it. For a lot of people, there's almost a neurological confusion that starts taking place, where there will be an interpretation, even though your body feels thirsty and needs fluid, there's dehydration going on, your brain starts to interpret it as hunger. And so for certain individuals, because they've kind of mistrained their body, and maybe they're overeating, or maybe they're just like not taking the time, they've denied that thirst mechanism so long, then for some people, when they're dehydrated, they actually start craving food and overeat instead of drinking the fluids that they need.
Yeah. Absolutely. One of the books that I read, the author who was an MD in it, he talked about how yes, many people can survive just. I shouldn't say just fine. Many people can survive drinking less than what is optimal for their body, but the title of this is optimal hydration, not necessarily what is survivable. And so yes, you can drink substantially less than what would be recommended. But the analogy he sort of gave that I thought was somewhat humorous is that we all start our lives as plums, and then by the end of our lives, we're more like prunes. And so that process of just chronic dehydration is going to make you maybe look and feel more like a prune towards the end of your life.
Yeah, you're making me thirsty just thinking about it. Man, I knew that was going to happen.
So I mentioned some of the ways that we lose water, but and you mentioned a couple of the ways in which we would consume it. But there is one other one that I would like to add, aside from just fluid consumption and food consumption. But that's also the air. Just like we can exhale water vapor, we can also breathe it in. And so you're going to be in a more humid environment. You're not going to lose as much water, right? And you can actually have a net gain potentially.
That makes sense.
So what the recommendations, sort of standard recommendations, I realize are going to be somewhat controversial. However, most of us have probably heard how much should we drink per day.
Well, typically, the rule of thumb is you take your body weight in pounds and then divide it by 2, and that's how many ounces that you should drink.
And I really like that recommendation. That's the one that I typically follow for myself as well. Many people have heard the 8 cups a day, right? That's another one. The National Academy of Medicine recommends for men 104 ounces and for women 72. Clearly, that's not considering it's only considering age above 19, right? And so there may be different recommendations, but depending on activity, body weight, and so on and so forth. But those, if you follow any of those guidelines, you're at least in the relative ballpark, right? But I do prefer, because it does give a little bit of that flexibility, like you said, dividing your weight in half and then using that as the number of ounces. So for somebody like myself, as a 200-pound man, I would, as a baseline, try to drink around 100 ounces a day. Okay. So you can also look up like stats on how many people or what percentage of people are actually dehydrated. And as you can probably imagine, how you come up with that is dependent on how you define dehydration, right? And because there's not really like a clear definition of what is mild versus moderate versus severe dehydration, or at least what is dehydration to begin with, you'll see anywhere between like maybe 15 to 75% of sort of the modern American being dehydrated.
Large range there.
Large range. But I think it is, even if it's only 20 to 25%, I still think it's an important topic, especially for those that are struggling with mental health issues, because my assumption, based on my experience with my patients, is that hydration tends to be something that is easily foregone during mental health crises.
Absolutely. And you think about, some of the symptoms of mental health challenges, especially like depression, for example, there's just a lack of motivation oftentimes to even like go and get a glass of water and drink it. It's like, why? Like, who cares? That's kind of the least of my concerns right now, right? Even though it could substantially help. And so, with that context in mind, what would you say are really some of the key benefits of staying well hydrated?
Before we actually move on to that, I wanted to say a quote from one of the books that I read that I thought was it was a good quote, and so I think it's relevant to this idea of how dehydration affects us. And Dr. Cohen from the book Quench, she said, "We believe that even mild chronic dehydration is the mother of all epidemics and can be linked to many common ailments. The cues are afternoon fatigue, a decline in cognitive performance, headaches, weakness, urinary tract infections, and constipation. But some other disorders resulting from dehydration can come as a surprise. Things like sleeplessness, decreased immunity, joint pain, chronic diseases like fibromyalgia, type 2 diabetes, acid reflux, and even dementia." Right. So those are some pretty bold claims, and I'm not necessarily suggesting that we have all the research to necessarily back a lot of those things up. But being that being that water is infused in every single cell of our body, when it's out of balance, it's not too far fetched, in at least my mind, to think that these things could at least be affected, negatively impacted by dehydration.
Absolutely. Makes sense.
So you mentioned what are some of the benefits of staying optimally hydrated. So a few of the physical benefits would include things like better hormone regulation. In men, testosterone needs water in order for it to be synthesized. Better weight and blood sugar control. And you kind of touched on this, right? If you're dehydrated, often that thirst urge is going to be misconstrued as being more of a hunger,
yeah.
right? Superior skin texture and appearance. So for all those people that want to look a little bit more beautiful, staying hydrated is definitely a good thing for that. Better digestion. It seems, I don't know about you, but it seems like almost all of my patients deal with some digestive issues from time to time. And it's not just because of the medications we give. A lot of them from baseline have some digestion issues. So staying adequately hydrated helps with that. Reducing joint pain and inflammation, reducing the risk of kidney stones, improved dental health as well is another big one, right? If your mouth is always dry, that is really bad for basically how your teeth actually naturally sort of clean themselves. And so it's important to stay hydrated for that too. But I do want to spend some time focusing on the mental health benefits, because that's obviously why we're here. So we already mentioned some of the cognitive enhancements from being adequately hydrated versus dehydrated. So this would include basic sort of cognitive things such as improved alertness, processing speed, memory, attention span. Those things can all be improved by adequate hydration.
Yeah, that's really one of the biggest things I've noticed personally is, especially like the doctor said from Quench, that afternoon fatigue. If I'm not well hydrated, my mental state, the concentration, the tiredness just really starts taking a hit. And then, if I rehydrate, that can really improve things substantially.
Give you a little bit of a second wind.
Yeah.
Yes. It can improve symptoms of depression. I think I've seen this myself with some of my patients, and I've not always, I think, been aware enough to realize that hydration was playing as much of a role as it probably was. But there was this simple study. They kind of evaluated those that at baseline were drinking less than 2 glasses of water per day, and then compared those to a population of patients that were drinking more than 5 glasses per day. So still at 5 glasses, like you could argue that maybe they were mildly dehydrated still, but those at two glasses or less per day had double the rates of depressive symptoms, right? And so clearly an association there. There's another study. Well, they actually, it was more of a study where they, rather than just observation, they actually, changed some things for the study participants. And so for the population, the cohort in the study that was averaging 2.5 liters per day, they restricted them to just a liter. So for those that don't understand liters, a liter is about 31 ounces, I believe. And so, going from 2.5, so that'd be about 75 ounces down to about 30 ounces. So the study participants that had their water intake reduced by about 60 to 70-ish%, they reported a decrease in contentedness, calmness, positive emotions, and feelings of vigor. And this was within just a couple of days.
Wow.
Right? So I think the study only lasted maybe a week, but by day 2 or 3,
they had enough.
They were already complaining of this, right?
Yeah.
So there's also just the improved mental performance, like you mentioned, having greater kind of duration of mental sort of sustain, if you will. And so it helps with like the intensity of your ability to perform with cognitive tasks, but also the duration of output.
Yeah, and I think along those lines, I often think about ADHD, right? And to me, it seems like they're really those ADHD symptoms can get significantly exacerbated when someone's dehydrated.
Yeah.
Because that concentration really, because I think, when you think about focus, we're talking about frontal lobe, and the frontal lobe is very sensitive. I mean, it's such a complex part of our brain. It really needs that blood flow, and blood flow has a lot to do with hydration status. And so,
Sure.
especially for those complex tasks and focus, et cetera, we need that hydration. So.
And this is not in my notes, but something I think that's worth sort of mentioning. We often think of the lifestyle factors that would contribute, particularly to an adolescent developing ADHD. And especially in this modern era, you and I both think a lot of excessive screen use.
Mm-hmm.
We think of really hyperpalatable foods. But the modern school system doesn't necessarily promote good hydration habits either, right? Somebody has to sit in a classroom for long periods of time and they're embarrassed to have to get up and use the bathroom, right? Especially if they already tend to be a little bit of a squirrely kid. There's that disincentive to consume, regular fluids throughout the day.
That's true.
So there's another study that looked at sleep duration and perceived quality. And I know some people might think, well, if you drink a bunch of water right before you go to bed, isn't that going to make it worse? So yeah, we're not talking about how much water you're drinking right before bed, but overall your hydration status throughout the day and over on. And so shorter sleep durations of 6 hours or less were associated with higher odds of inadequate hydration. So those that tended to on average drink less over the course of the day tended to have poorer sleep at night.
So, what about different types of water?
Yeah, so this is another kind of topic that's a little bit rife with controversy. So there's a few that we'll touch on. We're not going to touch on all of the different types, but I'll just briefly mention some of the pros and cons to consider about each of these. Tap water, unfortunately, is not particularly great if like I said, if you're just drinking it straight from the tap. And this is going to vary slightly depending on your locality and what what treatment facility is being used. Also, another consideration is your piping, right? And so there are definitely if you have older pipes, that can be more or less of a problem, kind of depending, and these things can be tested per se. But we know from multiple studies, like this is well established, that there are often endocrine disruptors found in tap water, and those with thyroid issues tend to be sort of the most sensitive. Now, you could say that maybe that's contributing to the thyroid issue, right? So it's a little bit of a chicken or the egg scenario, but that seems to be the endocrine system that is maybe most affected by some of those problematic compounds that are found in tap water. There's also disinfectant byproducts as well that seem to have some potential long-term health consequences. So, by the plant that disinfects the water, right? It's great that they're getting rid of things like cholera, but as a result, there are going to be some byproducts that may be problematic. And then, of course,
so are you talking about like things like chlorine and that sort of thing? Or?
Yes,
okay.
Yes. So that can definitely be a problem. And then there's also fluoride. And so fluoride is another one that, yes, there's a decent amount of controversy, I think, when it comes to fluoride. But this is also something that, at least at this point, is pretty well established to affect thyroid function, and so there's an article in Nature that talked about this extensively. That I was reading to sort of research this. Moving on though, for the sake of time, the next one is bottled water, and so bottled water, it contains a lot of microplastics, things like BPA and phthalates that definitely are known to have some fairly high risks to them. And there was a study where they analyzed a variety of different plastic water bottle companies, and they found that 93% of them contained, on average, and it was a huge range, but on average 325 plastic particulates per liter. Okay. So some of them were in the thousands. Others were, very, very, very low amounts. But on average, it was about 325. And then there's distilled water. So distilled, basically like everything is taken from it, which is why a lot of people call it like sort of flat or feel that it tastes kind of flat. It lacks the chlorine. It does lack the fluoride, but it also lacks the minerals. And so, the minerals like calcium and magnesium definitely are important as well. Also give it a more unique flavor. There's reverse osmosis that lacks the chlorine and the fluoride. Is able to preserve some of the mineral content, but a lot of it is taken out.
Do you know if the endocrine disruptors get filtered out by reverse osmosis?
Yes.
Okay.
Yes, they do. Reverse osmosis is a great way to go. Some people think it's a little bit overkill. Some of the units tend to be quite expensive, especially if you're buying one that's going to filter all the water that comes through your entire house, right? Most people from in my research just put a unit on the tap, right?
Yeah.
Versus filtering everything through it.
Yeah, because you're sitting here telling us we need to be hydrated, right? But then you're scaring us with all this danger.
We'll get there.
It makes me not want to drink.
And then there's another type of water, and this isn't necessarily something you can just easily get over the counter, but it's called structured water. And this is a very sort of budding science. I'm not even sure if you've heard of structured water.
Yes, I have,
before.
and I've done a little research on it, and actually even drank some myself.
Oh, you did? Okay.
Yeah, it's an interesting thing. I think there might be something to it, and the advocates really talk about when we use like the pipes and this sort of thing that in water in its natural state actually forms almost these, I don't think you'd call it crystalline, but like these structures. And it actually it's really fascinating when you start looking at some of the research that's been done and whatnot. And these, again, I think there's controversy and there's more research that needs to be done. But I think the claim is that our bodies can much more easily use the naturally occurring water that would come from like a stream or a natural body of water, essentially, instead of being piped through artificial pipes that kind of destroy, because water naturally has, of course, the hydrogen bonds, but then the H2O will form these kind of beautiful patterns that you can see in naturally occurring water. So.
Yeah. So structured water, an interesting topic. I think more research needs to be done.
Yeah.
I'm definitely intrigued by it. I think most scientists seem to be agreeing that this phase does in fact exist now. We're just unsure about what its benefits are per se.
So we've talked about types of water. Let's talk about electrolytes in water.
So the function of electrolytes is vast, and we won't necessarily have the time nor the brain power to probably go through all of that today. But the most important ones for the purposes of just maintaining optimal hydration are going to be that of sodium, potassium, calcium, and magnesium. And I'd throw, I guess, chloride in there as well. But these are really important for maintaining cellular and brain health. And the reason why these ones are important is because they maintain the fluid balance between the inside versus the outside of the cell. And so when we say extracellular, right, that means the outside of every kind of single cell in your body. And so the two electrolytes that are primarily involved in the regulation of extracellular fluid is going to be sodium and calcium. And sodium in particular is required for basically the function of nerve cells. Right? Remember action potentials, right? Mm-hmm. Without sodium, you can't have the proper firing of a neuron. And so it's incredibly important. Even though yes, like you can have too much sodium, but there's a balance to everything. And I think it's maybe worth considering. For those with psychomotor retardation, we've kind of talked about kind of an underactivation, what seems to be both a psychological and neurological functioning, that maybe some of those extracellular electrolytes like sodium and calcium may be potentially lacking, and the opposite could be true with the other intracellular electrolytes, which are predominantly potassium and magnesium in psychomotor activation. So I wasn't able to necessarily find any research on supplementing with those particular electrolytes, but I think it's an interesting consideration.
Yeah. So how much of our because obviously we can get electrolytes from food as well. I mean, how important do you think it really is to be trying to get water that has some level of electrolytes in it?
It depends. I would say it depends on your diet, and it depends on how physically active you are, right? How much you sweat.
Okay.
And so, if you're eating a whole food diet and you're getting a lot of potassium and magnesium rich foods, and then or maybe and those foods are, say, salted, right? And we'll get into like maybe different types of salts, which may be preferential or whatnot. Then it may not be too important to necessarily be adding electrolytes to your water throughout the day. However, like I can speak from personal experience, and I know this is a very common thing nowadays, especially with it seems over the last few years there's been sort of a mass interest in these sort of electrolyte powders and beverages and things of that nature. And we'll say that a lot of those are not necessarily good for you if they're chock full of a bunch of either artificial or real sugar, right? But there can be a place for some of those electrolytes, especially in the context of sweating, hot climates, exercising, and or just the need of rapid rehydration for a variety of different reasons, right?
That makes sense.
So one of the books that I read, he talked about salt in particular as it relates to just the general sort of health benefits. And one of the takeaways that I had from that was using maybe a natural salt, something like Celtic sea salt or regular sea salt, Himalayan pink salt, Redmond real salt. These things are not just going to contain the sodium and the chloride, like what you get from, say, iodized salt. You're also not going to get the additives that you also get with that, or the dyes that they use for that. And you're also going to get a ton of trace minerals. Most of the ones that I just mentioned are generally reported to have anywhere between like 50 to 60 trace minerals. And so it's fairly interesting. Some people have said that the natural mineral content found in sea salt, you don't want to drink salt water because it's way too salty, but just for the amount of salt that we need, those other trace minerals in there are really at seemingly proper proportions for a lot of human proper metabolic function.
Which is kind of interesting because I was even thinking how we're talking about essentially the body being about roughly 2/3 water, right? And about 2/3 of the earth is covered in water too, which is kind of interesting when you look at all that, and then you realize like, oh wow, a lot of the proportions in the seawater are actually what our body needs, and so yeah. A lot of interesting things there.
Yeah, it is. I've been a little bit more, after reading the book, I will admit I've been a little bit more judicious with adding these natural salts to my food as a means of flavoring, particularly foods that I don't find all that palatable. And so, we've been using a little bit more Celtic and Himalayan pink salt on our, fresh or cooked vegetables and things of that nature. So
yeah, I'm a big pink salt guy.
Yeah. One more comment that I'll just mention on the electrolyte component is I want to emphasize that sodium, calcium, these things tend to activate nerve function, whereas potassium and magnesium tend to inhibit nerve function. So it may be, as I said before, worth considering if you tend to be a little bit on the sluggish side, especially first thing in the morning. A little natural salt in your water might be a great kickstart to your day. If you tend to be...
If you're already hyperactive first thing, then maybe a little magnesium.
A little magnesium, exactly.
Got it. So putting all this together, what's kind of a practical approach to how we can approach hydration?
So I'll tell our listeners kind of what I'm doing these days. Now, this is not necessarily medical advice, right? We're just here to express our opinions on the research that we've looked at and how we're applying it to our own lives. But I'll kind of walk through sort of a typical day and how I think about where I'm getting my hydration. So in the morning, what I've been doing lately, I've been adding about a quarter of a teaspoon of natural salt to anywhere between 12 to 24 ounces of water. All right, so that gives me that sodium first thing in the morning, especially after I've been without any sort of fluid for maybe 8 to 12 hours before. And usually I will have some chia seeds kind of soaked. For our audience, they might think they might be a little surprised by that. But chia seeds can absorb over 10 times their weight in water. And so it sort of slows down, because if you just drink straight water, it actually goes through you pretty quickly. The chia seeds, the surrounding part of it where it gelatinizes, may actually be structured water. And so your ability to absorb it and utilize it may be more rapid and more useful.
Yeah, it's interesting because I actually do something similar, not with chia, but with psyllium husk.
Okay.
I usually do a little bit of psyllium husk in my, I'll drink a couple glasses first thing, and then I'll do another glass with just psyllium husk with the water. And I agree. I think it just kind of like slows everything down, allows you to absorb better, et cetera.
And there are many ways to get similar effects. It doesn't have to be either of these two either. Even adding a little bit of lime or lemon juice to your water first thing in the morning. There's components that are hydrating in the juice itself, right? And I'm not necessarily suggesting like high sugar juices to be used for optimal hydration, but a little bit of lemon or lime, both a great flavoring, has some antioxidant properties, but also may enhance the overall hydration effect from it. And then usually what I'm doing throughout the day is I'm taking approximately or drinking approximately half my body weight in ounces. And I'm usually going to try to prioritize that for the first 10 to 12 hours of the day. Our kidneys tend to filter things more rapidly. They sort of work on a circadian clock or biological clock that's in concert with our circadian rhythm. And so they speed up during the day and they slow down within a few hours of you going to bed and while you're asleep. So to get the best hydration, but not to be waking up multiple times throughout the night, it's typically a good idea anywhere between 2 to 4 hours before you go to bed to cut off the fluids.
Yeah, and that's pretty much what I've learned too. And that's why it's all the more important to really front load the hydration, right? And that's, I think I've been by far most successful, like trying to get, usually I'm probably getting a good 24 ounces in, before I even eat breakfast, right? To really hydrate myself first thing, because in reality, it's not ideal to be like drinking with your meals and stuff, right? Because that can really dilute your digestive enzymes, and so it's better to get that fluid in you before your meals and allow you to absorb that, and then you can wait, at least an hour or so after your meals so that your stomach can digest the contents of the food, empty into your small intestine, and then you can freely drink again. But getting ahead of the game, I think early seems to be key.
Yeah, I really like to, like I said, start my day with a big glass, and then for the remainder of the next 10 hours or so, try to drink it relatively steadily. And it doesn't have to be perfect per se, right? But for me, what works, especially when I'm at work, I have a half-gallon bottle just kind of sitting next to my desk. And so I'll just go ahead and take sips of that, as I'm going throughout my day.
Now, just circling back real quick on the types of water, because, you listed a bunch and problems with a lot of those as far as, potential tap water and then bottled water, et cetera. So what do you think is the best source of water for us, generally speaking?
It's a great question. I mean, I think if you can afford it, then reverse osmosis, and it doesn't actually have to be that expensive. I've seen some I've seen some products on Amazon for maybe $150 that can do the reverse osmosis that you just plug onto your unit, and then that'll take care of it. Most people have purifiers as well, so you can get them for your fridge, or you can buy one that you fill up, and it can contain maybe half a gallon of water or something, and you just stick it in your fridge and it goes through. When you do the purifier though, you do really want to find something that has an adequate, that is advertised at least to be able to remove the fluoride.
Okay.
So that's probably the most important thing. So whether you go reverse osmosis or purified, or you even go distilled, even though this distilled doesn't have the minerals, like if you've got a good diet, you can really get the minerals that way. So it's not too crucial. But one of those strategies I think would probably be optimal for most people.
Makes sense.
And then a couple other things that I'm kind of prioritizing in order to optimize my hydration: consuming water-rich foods. So most fruits and vegetables in particular tend to be 80+% water concentration. And so, like you said earlier, we can actually get a lot of our water just in the foods that we eat. And so if you don't want to drink a bunch of water, if you eat more fruits and vegetables, you're going to, especially non-cooked or non-dehydrated fruits or vegetables, obviously, you should be able to achieve a lot of the water requirements. Okay. The thing that I would say are hydration powerhouses are smoothies. So one of my general recommendations for most of my patients when it comes to a nutrition / hydration recommendation, you can kill multiple birds with one stone, is getting a nice big smoothie in every single day. Okay.
Awesome. Well, thanks so much for all the practical tips. Anything else before we sign off?
I think that is probably it for today. And yeah, thank you for listening.
Well, I know that you are saying, yes, you fully lived up to the expectations, right? So I'm sure that you are all very motivated to stay hydrated, and happy drinking, everybody.
Thanks for listening. To hear more episodes, find us on social media, or support us financially, visit thebrainpeoplepodcast.com.